Dr. Hill, again, another video coming your way. Today is going to be about some questions. So what my perfect team did is they went on to Reddit and found a bunch of questions that are, I guess, asked to dentists, or people on Reddit ask them to dentists. So what we're going to do is we're going to answer some questions. Again, I have no idea what the questions are. As you know, I never see anything until we're sitting in front of a camera. So more so reaction, more so answers on the fly. We're gonna go through it together, and let's start answering some questions from Reddit. I'm ready. Let's do it. How effective or ineffective is brushing your teeth without toothpaste? I don't know why you wouldn't have toothpaste, but I'll answer the question. So basically, I'm gonna tell you it's effective in the fact that you're going to be able to get debris off of your teeth. It's effective in the fact that you're going to be able to kind of feel a little cleaner, things like that. Where it is ineffective is that you're not getting any of the benefits of the toothpaste, right? We've all heard the fluoride thing. Fluoride in the toothpaste, or fluoridated toothpaste, whatever you want to call it, is a huge benefit, and that's really where we kind of continue to strengthen our teeth, kind of avoid cavities, things of that nature. Now, as nice as it is to get stuff off your teeth, the real kicker in that is the addition of some type of toothpaste that's going to have some type of fluoride in it or whatnot to strengthen the teeth, make sure we can avoid the cavities, make sure we can avoid any pain, discomfort, sensitivity, things of that nature. Brush teeth before breakfast or after breakfast, after lunch or before lunch, soft bristles or hard bristles? Well, first off, as long as you're brushing your teeth, I'm good with it. To me, I'm a brush your teeth after breakfast kind of guy, because then that way you can start your day out, you can go about your day, and you can also brush off all the stuff you just ate. If you eat sugary stuff in the morning, things like that, brushing it after to get that stuff off your teeth to go about your day is a better thing. Obviously, same thing with lunch. If you can brush after lunch, you're going to get more benefit for it. You're going to get all the stuff you ate at lunch off your teeth, and you're going to then be cleaner throughout the day. And you have to remember, it's all about the amount of time, or the exposure of time on these teeth is what breaks down cavities. If you eat or drink something sugary or whatever, acidic, anything like that, but soon after that you rinse with water, you brush your teeth, you're going to be in better shape than somebody that maybe brushes their teeth first thing they wake up, they eat sugary, acidic stuff all day, drink Mountain Dew all day, and then they don't brush until the end of the night. That way, that's where those people get into problems and issues. Now, soft bristles, hard bristles, this train of thought has changed throughout time. Soft bristles nowadays are the way to go. The reason why, from in the past, we found out, or I guess the researchers and science found out, that patients were brushing so hard and then they were adding on top of that hard bristles that it was actually kind of taking away some of the benefits of brushing, right? You were kind of wearing away teeth. You were doing damage on healthy teeth. So the real kicker nowadays, soft bristles are a little bit better as long as you're brushing it. And truly, to be honest with you, add in a little caveat: electric toothbrushes. Game changer. I am telling you, you get an electric toothbrush, they are worth the money, they last a long time, and they will make you feel completely different than you do with one of those manual toothbrushes. Trust me. Hygiene routine order. In what order should I brush, floss, mouthwash? Great question. I love this question. I get this question probably a lot more than I ever thought I would. And it's more so they ask me what I do. I will tell you what I do. I think if you are doing all three of these, you are A+ already, so I wouldn't be too concerned, okay? Because I guarantee you there's not a lot of people out there that do all three of these. I do all three of these every single night in the same order. My order, okay, is I actually floss, then I use my mouth rinse, and the last thing I do is actually brush. Now, here's my validation for it and the reason why I do it. When I use my toothbrush, I obviously use toothpaste. The toothpaste has the fluoride in it. What I want to do is, the last thing I do is I want that fluoride staying on my teeth. That way it can kind of do its thing for a longer amount of time. One key to this is when you brush your teeth, okay, the last thing, you do not want to rinse all that stuff out. So people that brush with the toothpaste, okay, and then they put water in there, swirl it, and then spit it back out, you're actually kind of, you're eliminating a lot of the benefits you could get. The way to do it properly, anytime you brush, is to brush, okay? Obviously you spit out all the toothpaste. You do not swallow toothpaste, okay? Brush your tongue. People forget that, okay? And then when you're done with it, you literally just spit out the toothpaste and you go about it, okay? Don't use water to rinse out. Don't use any of that stuff. Just let the fluoride in the toothpaste do its thing, and you are going to be healthier, happier. You're going to have fresher teeth. It's going to be better. Everybody wants fresh breath as well. So if you're someone that does all three of these, you're winning already. But to me, I always like to use the fluoridated toothpaste last, let it do its thing, and go about it. Is it bad to use multiple teeth whiteners at the same time? I just started using teeth whitening treatment. Squeeze on the gel and hold for 5 minutes. Is it bad to start using teeth whitening strips? Awesome. I mean, good question, tough answer. To me, I think you stick to a whitener and you go about it. I think some patients or some people try to get this, bright white, or as I call it, because most of us have seen Friends, that Ross Geller episode where he has such bright white teeth. When the lights go out, you can see it like from the street kind of thing. I think you use too much of a whitening setup, you're going to start having other issues. Potentially sensitivity is a big one. Some of these whiteners that are out there, that do it yourself at home whiteners, or some of these ones that you get like off Amazon and all this stuff, some of it, the gel is just too much. It's abrasive. It can kind of break down teeth instead of really whitening them. So to me, I think if you're going with a whitener, I would stick to it. Now, they have the toothpaste whiteners, the mouth rinse whiteners, all that kind of stuff. If you use that regularly, and then on top of that you do Crest white strips and stuff, I think you're going to be fine. But my thought when asking this question is more so like somebody that's doing like whitening in the morning, and then a different whitener at lunch, and then a different whitener when they get home, things like that. I think at a point you're going to be pushing the envelope, and you're going to know it. You're going to start feeling sensitivity. You're going to start having some of those issues. So honestly, great question. These are good questions. Permanent retainer, remove or repair. Love this. Get this topic all day, every day. I will tell you, an orthodontist who do the braces will probably chime in on this. The school of thought on this is, why are we putting a retainer in? What I mean by that is, what did their teeth look like prior to doing orthodontics when they moved them? Okay. If it is a significant and severe movement, okay, most orthodontists will tell you that they are going to place permanent retainers on there. That way there is no chance for those teeth to shift back, okay? Nowadays, we're doing a lot of the Invisalign, the clear aligners, things like that. Those come with clear retainers at the end of it. To me, younger generation population, whatever you want to call it, permanent retainer all day, every day. And the reason why, I was a kid, I was a high school student, a young college kid, whatever, there's no chance I would have worn a retainer at night. Zero chance. So permanent retainer for me makes a lot of sense there. Now, as we age, clear retainers make a little bit more sense. Hopefully adults are a little bit more responsible, I guess is how you would look at it. One thing that I have a problem with on permanent retainers is it does, on a majority of patients, make it a little bit more difficult to floss underneath of, for two reasons. Number one, sometimes it begins to hurt the patient. The gums are a little swollen under there, and so patients stop flossing there. Number two, it's harder. It takes a little bit more time. You have to use a certain type of floss threader, and a lot of patients don't want to do that. That is another issue. That is a con of a permanent retainer. In a question like this, I think this is a personal choice for the dentist and the patient that they can make as a team and kind of come up with a good answer. When you're looking at these permanent retainers, repair or remove, I kind of look at a couple different things. First of all, the age of the person, okay? I also look at the health of the gums, and I also look at the responsibility of the patient. And if you ask a patient, or if a patient asks me, I will tell them flat out, like, are you gonna wear it or are you not gonna wear a clear retainer at night? If a patient just tells me, no, there's no chance I'm wearing it, well, then we're gonna repair it. If the patient thinks they're responsible enough that they can wear it 3, 4, 5, 6, 7 nights in a week, yeah, I'm cool with removing the permanent retainer. Orthodontists probably won't like me for that answer, but it's the truth. I would rather a patient be able to take care of their gums, and floss and actually not have all this buildup in it underneath these permanent retainers than having a permanent retainer, because it's a bigger issue health-wise than anything. I'm actually impressed with these. These are great questions. This was awesome. This is cool. These are questions that I like. These are questions that I like to answer. So if you can think of any questions like this, send them. Add them to this. If you have a comment about something I said, go ahead and ask me. I'll gladly tell you what's going on with it. But go ahead and like, subscribe, send some stuff in. I'll see you for the next video. Later.